Precision medicine is not really a new concept, it's a new term. It's all about diagnosis and being able to make precise diagnostic categories that reflect our understanding of the disease. The idea of treating cancer as a disease that can be segregated into parts that are more narrowly defined than simply the organ in which the cancer arises, lung cancer, leukemias, kidney cancer, began in a most serious way with the discovery of the genes and the mutations that drive cancers. And arguably the greatest excitement came when we began to develop therapies, Herceptin, perhaps most notably Gleevec, for the treatment of disease based on the actual nature of the mutations that are driving those cancers. And I think everyone got particularly excited about making the diagnostic category clearer on a molecular basis with the arrival of Gleevec, which successfully treats virtually every patient with chronic myeloid leukemia. Over the succeeding years, many additional examples had occurred. Cancer in some ways is the most difficult of all the diseases to approach with precision tools. The diagnosis is very difficult because every cancer is different and very complex and consisting of cells with mutations that are numerous. Not all of them are equally important functionally. And moreover, the disease is continuing to evolve during the course of a patient's treatment and observation. So it is a moving target, and as a result, most of the therapies that have been developed are complicated to deliver because of drug resistance, which we have yet to learn to overcome. Since the political aspect of this has been mentioned, let me just say briefly that I am among many who are very pleased by the President's taking this on as an initiative and giving it prominence, because I think it represents a flowering of the investment the government's made in basic science for the last 50 years or so, and should be better known by the public. Nevertheless, the amount of money that's being asked for is, first of all, only a request. It's a modest amount. Congress may or may not give it to us. The NCI budget is not going to appreciably increase as a result. The budget is $5 billion, roughly. An extra $70 million is important, but we don't have it yet. I think the importance of the initiative is to say, yes, the President and other members of the government and the public are going to be watching the NCI and NCI's grantees for progress against cancer based on these new developments. And we will try to encourage the Congress to give NIH some more money based on these high-flying objectives. But I think applause is appropriate, at least for that portion of the $215 million that he's asking for that goes to the NCI for cancer research.